Interpreters, please.
Did you ask me to go ahead? I'm sorry, the recording in progress announcement.
Yes, please.
Okay, thank you. Hi, everyone. My name is Erwin, and I'll be giving an announcement in both English and Spanish. Once again, my name is Erwin, and along with Lars, we'll be interpreting from English to Spanish during today's session. And we will also be offering ASL interpretation with interpreters Heidi and Anne. First, we would like to thank the organizers of this event for their commitment to language justice and to creating multilingual spaces. Language justice includes being able to speak, understand, and be understood in the language in which we feel most comfortable. Creating multilingual spaces is not the responsibility of the interpreters only, but of everyone here. So we'll be sharing some guidelines with you. For those presenting today, you can help by speaking at a moderate pace, loudly and clearly. If you are reading from your notes, we do recommend you slow down that pace because that is not your typical speaking cadence. If we need you to speak more slowly or loudly, we'll let you know through the chat. For all participants, please don't suffer in silence. If interpretation is not working or you're having other technical difficulties, please let us know through the chat so we can help you. The interpretation function for this event has been turned on. You should see a globe icon on the bottom part of your screen with a message about language interpretation. Click on the globe, select the language in which you would like to participate and listen to during this session. And if you're joining us through a smartphone or tablet, you should see 3 little dots on the bottom right-hand corner of the screen. Select language interpretation, then choose your language and make sure you click on done, and you'll be set. Switching to Spanish. Hola, mi nombre es Irvin y junto con Lars estaremos interpretando de inglés a español y español al inglés durante la sesión de hoy. También tenemos intérpretes de lenguaje de señas americano, las intérpretes por el nombre de Anne y Heidi. Primero que nada, queremos agradecer a los organizadores de este evento por su compromiso a la justicia del lenguaje y al crear espacios multilingües. La justicia del lenguaje incluye poder hablar, entender y ser entendidas en el idioma en el que nos sintamos más cómodos. El crear espacios multilingües no es solo la responsabilidad de los intérpretes, sino de todas las personas presentes, y por eso les vamos a compartir unas pautas. Para los presentadores de hoy, pueden ayudar hablando a un ritmo moderado, voz alta y claramente en su micrófono. Si necesitamos que hablen más despacio o más fuerte, se les dejará saber a través del chat. Para todos los participantes, por favor, no sufran en silencio. Si la interpretación no está funcionando o está teniendo otras dificultades técnicas, déjenos saber a través del chat para poderle asistir. La función de interpretación ya ha sido encendida para este evento. Podrá ver un globo en la parte baja de sus pantallas con un mensaje sobre la interpretación de idiomas. Hagan clic en el globo terráqueo y elijan el idioma en el que les gustaría participar y escuchar durante la sesión de hoy. Si nos acompaña a través de su celular o tableta, podrá ver 3 puntitos en la esquina derecha, parte de su pantalla, y elija interpretaciones de idioma. Seleccione su idioma y asegúrese de hacer clic en finalizado o done y estarán listas. Thank you.
Next slide, Brecken.
Thank you. Welcome to the National Resource Center's Policy and Research Briefing. My name is Shenna Morris. I identify as Black and use she, her pronouns. I am the Vice President of Policy and Systems Change at the National Resource Center. Today, I am wearing a blue blouse, glasses, and I have my woven together hair pulled back. We'd like to take some time to review a few brief housekeeping notes with you. As we've just shared, We are committed to making this an equitable space in which people of all abilities can participate fully and in their preferred language. This takes everyone's commitment and effort to make a reality. For example, please be considerate and intentional of the use of the chat function today. It is difficult to translate the chat in real time and can be inaccessible to assistive devices. Please send any questions, comments, or resources directly to the event host and co-host, who you will see are both noted as NRCDV Training Institute. We will take the time to read the questions or comments aloud so they can be interpreted. While we aim to make this a mixed ability and multilingual space, we also know we're still learning how to do this well. Please reach out to event staff during the webinar if you are experiencing any accessibility issues. We'll also ask about accessibility in our post-webinar evaluation. Please let us know your experience and ways that we can improve. We know we still have much to learn and we want to improve our practices. This event features live captioning, and you can access this feature by clicking Caption at the bottom of your screen. We are recording today's event and will share it through our website and YouTube channel. Again, please reach out to our staff if you are experiencing ongoing technical issues, but please note that we may have limited capacity to resolve issues while the webinar is running. Today's policy and research brief will focus on NRCDV's expanded flexible funding report. This expanded report took a deeper dive into the needs and experiences of Black, Indigenous, and people of color LGBTQ survivors. You will also hear policy recommendations that are relevant to addressing the needs and experiences expressed in the report. Again, welcome to NRCDV's Policy and Research Briefing. And with that, I will turn it over to our Director of Community Engagement, Lavon Morris-Grant.
Thank you, Shenna, and good afternoon to everyone. I am honored to be here and be a part of this awesome policy research briefing that we do once a year. And with that, as Shenna said, I am Lavon Morris-Grant, Director of Community Engagement at the National Resource Center on Domestic Violence. I would like to bring in two of our panelists, but before I do that, I'm remembering to do better of describing myself. I identify as an African-American woman. I have braided hair that's pulled up into a bun. I am a brown-skinned woman. I have on reddish color lipstick with a reddish orange type blouse and 2 gold chains and some gold earrings. And so that's who I am. And as I introduce two of our wonderful panelists, they will also describe who they are. But before doing that, I would like to say that for this flex funding portion of our work, I've had the honor to work with TL and part with Tony for the last 2 years and discovering how we can do better with flex funding for survivors. So with that, TL Waid is the site director of GLOW, which is an extension of the LGBT Center in Harrisburg, Pennsylvania. And Anthony Hall, which we fondly call Tony, is the housing case manager with GLOW, with another extension with the LGBT Center. And with that, TL, I would like to bring you in first to introduce yourself as well.
Hi, my name is TL Waid, and as Lavon said, I am the site director at GLOW Harrisburg. And today I'm wearing glasses and a gray t-shirt. I have long hair and it's laying over my right shoulder right now. Just want to say thank you for having me here today.
And Tony?
Good afternoon, everyone. My name is Tony Hall. I am the housing case manager for GLOW Harrisburg. I am an African-American male, black cap, and a gray hoodie.
Thank you, Tony and TL. And so what we will do, we will jump right in to the work that's been done once again over this last research period. And TL, I would like to address the first question to you. Based on the first flex funding that we did, I remember the center discovering the amount of work that was different from the way we usually do grants or the way they usually do their grants, that they discovered that they really needed to have someone else in the position to work the flex funding program with survivors. So TL, can you tell us a little bit about when they approached you to be a part of this team, your experience and expectations of what you had coming from where you came from, and then coming into the LGBT Center, working with flex funding?
When I started with GLOW Harrisburg, they had already begun using the flex funding. So I was coming in from the hospital system, which, as most of you know, is drastically different as far as how monies are spent and how people are able to receive funding. So for me, it was a little shocking at first to come in and find out that, hey, we're going to give people money. We're not going to make them wait 6 months for it. We're not going to make them fill out 20 different forms and ask them just a lot of ridiculous and unnecessary questions. So it was very different for me, but I was able to quickly get on board with the process and help in my new role. I started off as housing case manager, so I handled a lot of the flex funding when I came in. So it took a minute, but I got on board with the way they were doing it, and I feel like it was much more beneficial to people than any other system I had previously seen before entering at GLOW.
So TL, thank you for that. Just for those who are still trying to figure out how to work with flex funding and the principles and tenets of flex funding, can you just share a little bit about when you did transition, how did that translate to this, not to staff, but to the participants of the program? And how did you experience the participants in the program receiving the funds?
The new participants coming in that I worked with were probably as shocked as I was that we were not going to make them go through a lot of hassle to get the funding that they needed. People came in, they had real life problems and things needed to be taken care of and taken care of quickly for most of them. A lot of times it was things where they were looking at, their car broke down, now they can't get to work, which means they can't feed their children or whoever else is living with them, or even themselves. And other agencies that they talk to in the city, they were able to fill out forms, but it was maybe like a 4 or 5 step process, and then no guarantee of getting any funds to help them with the issues that they were having. And we just were able to help them most times, if not on the spot, within 2 days. We were able to help those people. So it made a huge difference for a lot of them.
Thank you, TL. And Tony, I know from the work we've done over the first Flex funding, you've been with the organization when we first started out and I first met you. And you may have had a little bit more hands-on in the beginning of the program. Can you just share a little bit before we get to the participants of how you all from the staff perspective were in your meetings when you discovered and learned that not only were you going to do flex funding, but that you were going to do flex funding with no questions asked of this to the participants, and staff is to just give the participants what they are asking for without question. How was that in the background for the staff, if you would like to share that with us?
Yes, so as TL said, it was a shock for all of us. Um, all of us pretty much came into this work from a corporate background, from a corporate setting. So the idea that we had all this funding and grateful for it, but we had no idea how we would disseminate this funding. We had no idea, no like structure for how we would like all this would come together. So it took a lot of talking, a lot of conversations on how we would do this and how we could do it in a way that's most beneficial to the participant. And at the same time, meeting the expectations of not only our grant funders, but also the organizations that we work with. So it was a counterbalance. And when we broke it down, we decided that we were going to use the grant language itself and just go about giving out the money that way. Um, we had to make sure that we could track it and make sure that payments were made and things like that. But we overall, the project, like I said in itself, it was the first of its kind for any of us. And although it was a shock, we got used to the idea that we could make significant changes for our participants in eliminating all of those barriers. And we kind of became a safety net as a result for the vast majority of our participants. So many agencies, so many people, so many agencies weren't able to catch the people that we were able to catch. And like I said before, eliminate those barriers. So it felt really good after a while working the project to actually see um, it actually take hold in people and make their lives a little bit easier.
Thank you for that, Tony. When you use the language catch, can you just explain or expand a little bit about what do you mean or the organization means by you were able to catch some of the participants that other organizations were not able to do, and give some like examples of what the catch was or looked like for you all?
So when I think about it, we live in the capital region. We have a host of resources, right? So what we found post pandemic was that most of these services were jammed up. Participants, not just our participants, but citywide, agencies weren't able to help people in the ways that they were designed to. So our organization kind of, and I'm grateful for this, we were able to, I don't want to say catch, but I want to say we were able to create a situation where our participants could utilize the resources, well, more resources. We were just an additional resource to what is already here in the city. Um, and in a way, we became kind of like a safety net for our community in that, okay, we're living in the capital region. We have all of these resources. Most of these resources aren't able to help our people, but we know where we can go to actually get the help that we need. So that's what I mean in terms of like a safety net of sorts.
Thanks, Tony. Thank you. TL, for you moving into the site director position and being originally in the other position, working with the participants, how do you see or believe with the flex funding, how do you believe that was able to extend and expand to the participants towards their housing, particularly in the LGBT community?
As far as how it helped with the housing, it helped us pick up the pieces that our other grant funding didn't really leave room for. We housed a lot of people last year. I think we housed maybe 30 people. But what we realized in the middle of it was, okay, great. These people have a house now, they have a roof over their head, but they're still sleeping on the floor.
Right.
So flex funding helped with some things like that. Okay, so you're living in a place, but here you need a bed. We were able to get a bed, you know, that same week, get them off the floor. Everybody's feeling better about that. You know, maybe they just need, they went into an empty apartment with nothing but their backpack. Now we have some personal hygiene stuff for you, things like that. You need a deposit to set up the electricity, which, you know, was huge. The flex funding was huge, was with helping with things like deposits to get utilities turned on. So, I mean, they worked well together, the flex funding along with our housing project, and it just made everything a little more cohesive and easier for the participant. So, yeah, I'm just really excited about the way that all played out. And I think the participants were extremely grateful and just surprised that with the flex funding, we were able to make things move so quickly. Because I also want to, can I also add that a lot of our participants were coming from a state of complete homelessness. So going to other agencies, not only did they have multiple steps within that agency, but the agency would send them out because you don't have an ID, you don't have a copy of your social security card. So we didn't have, with the flex funding, we didn't have to wait to help people while we were maybe setting up their electricity. We also took them down to get their social security card, but that didn't have to be the first step for them.
Wow, TL, I wish we had more time to even delve more into the steps, as you mentioned, because we know it's the steps, right, and these bureaucracies that hold up so much of everything is a priority, right? But which one gets the extra priority in the work, particularly around, you know, housing and all the pieces that need to go along with getting housing, and then being able to offer wraparound services, right? Supportive services for participants who may not be fully ready to go into housing, but they need other amenities to get them set up. And so, TL, with that, can you just give a brief overview, not just about the participants, right, and how they were faring, just how was generally, how was the morale, how was the input from the participants, you know, how were they coming back to try to work within the program from a different perspective of the help that you all were able to provide, particularly those TL who came back more than once for services? How was that received?
I think things went well. We had people that came in with legitimate needs, and you would think with something like flex funding, you would see people attempting to abuse the system. We really didn't see a lot of that. Surprisingly enough, we saw people that came in, you know, and they would come in with a bill in hand or, you know, some type of paperwork showing that they had need without us even saying, hey, bring us, you know, something legitimate to look at. But we took care of the need and they were able to move on from that point. So you asked us to help with, you know, your car issue. We helped with the car issue, and these people were able to move on with what they needed to do. And I think that the morale it built, not only within the organization, but with the people we worked with, led to them, okay, we helped them now. Oh, so you know, this other participant needs a ride. Glow helped me get my car fixed. Now let me help this person get to work also. So it had a really great trickle down effect. So not only were we helping people, but the people we helped were helping additional people.
Thank you for that, TL. Tony, in your position as the housing case manager, were there any particular comments that participants were making to you about receiving flex funding, and particularly those who may not have gotten the flex funding in the beginning, and then they saw and they had to go through so many hoops in the beginning when there was no extra money, opposed to those participants who were able to be recipients of the flex funding. Was there some dissonance between participants during that, particularly during the first flex funding cycle, opposed to the second when that came about?
No, participant morale was really good throughout the entire process in my experience. Um, I think everyone was just grateful to receive something after going through so many roadblocks because believe it or not, Glow is normally the last stop for most participants. Usually they've utilized nearly all of their resources. So when they've come to Glow, they're exhausted emotionally, physically. They're pretty much out of options. So for us, just to be able to provide something, 9 times out of 10, it was like 100% of what they needed. But even if it was 10%, they would have still been grateful just to receive that. But thankfully, we were able to do a lot more than that. So, like I said, throughout the entire process, participants were grateful. And that kept them coming back, not just for services, but just as a place to build community, as TL said, amongst themselves.
Yes, one of the, in this process of learning flex funding and dealing with flex funding, one of the biggest roadblocks that I've been finding based on the questions that other organizations ask, they get stopped or stumped at the part, I guess it may be two parts, where you don't have to ask any questions, right? You just give the money to the recipients, to the participants without any questions, without any paperwork. Our mindset is not built that way based on the way we've been socialized with receiving funds from funders. And the second one is when the other big question I get asked is, how come I have to keep giving money to the same person if I already gave the money when we only have a limited amount and other people may need it? And I remember my response was, you just give it until it's gone, whether it's 5 times to one person or whatever it is. Those have been some of the, I think still some of the biggest issues around flex funding or the principles of flex funding, right? That still gets in, that we create the barrier for our participants. And so with that, TL, how have you seen the organization within staff be able to move forward in that positive light? If we are able one day to get fully to flex funding without asking participants questions, how do you think this experience has helped the organization to be able to be use your model as an approach to do flex funding the way you all were able to do that?
I think that we've gotten into a good groove with it. So we have good procedures and policies as far as how we handle it internally now, which is really important because I believe it made a lot of changes to the way our money people, handled disbursements, how they were going to track it, because money always still has to be tracked. We had to know what was coming out, where it was going, things like that. But yeah, we got into a good groove with it, and also it created a lot of hustle on our end, but we were okay with it. In case people are thinking, no, we did not just, open a drawer and hand people cash. So it was a lot of like things where we had to go out and get gift cards for people, like Visa gift cards for them to use, or, we had to make phone calls ourselves to utility companies to pay the utility bill, things like that. And as far as people coming back multiple times, people have more than one need. When they come to us with their first immediate need. Makes sense. Once you get that taken care of, they may realize, hey, I'm great now, but I'm still sitting in my apartment on the floor eating out of a can because I don't have an actual stove in my apartment or microwave, anything like that. So you address that need, any need that you can help them with to help them move on and create a better life is the goal. And in the midst of all that, you have the case management, which helps them be able to sustain what we've done for them. So
So TL and Tony, this question is for the both of you. Just so we can, get things in as tight as we can before we wrap up. How do you think, and TL, this may be a little difficult for you because you weren't there, but just from your learning once you came in, how do you see some of the challenges prior to the organization receiving flex funding? And when I say challenges, I mean challenges towards housing. What were some of the barriers that was helping your participants to go into housing much more smoothly? Can you just share with us some of the challenges in your community that you were seeing in that population? That's for the both of you, actually.
Okay. So for the first round, housing, it didn't go particularly smooth for a lot of our participants, only because we were partnering with other agencies. So a lot of we could do some of the work, but it wasn't like we could handle the entire thing. But once TL came on board, it totally changed the trajectory for what we were able to do as far as housing. We were able to streamline the process a lot smoother and a lot quicker. And it wasn't a thing to where we could like outsourcing. I think we realized that for something as sensitive as housing, that we needed to be the ones on the ground, on top of the situation, as opposed to relying on a community partner who's bigger than us, but also may have 10 times more clients than us. So coming from that perspective, as I said, we were able to come in the second round and really just take off the ground running. TL designed a framework for our housing, and she really, really stepped up our game. And that became really, as she said before, the thing that people came to Glow for, that was like their immediate need. But because of that, we were able to break through with so much more. Services that they needed afterwards. And we were able to create. Now, all of this, obviously, it sounds great, but we kind of learned on the fly. And now, like as TL said before, we've like found a groove to it. And things are streamlined, things are a lot better. But initially in those first days, as I said, being able to take control of the project with flex funding ourselves and make it our own, we were able to sustain a population of people that are still housed to this day.
And TL, you can expand upon that, especially about the streamline. Like, what did that look like prior, and what did it look like once you streamlined? And I asked you this, TL, mainly because for those listening, right, for others to understand that housing in our work, it does require 2 to 3 people to be working strictly just on housing, even though it's DV, connected to DV survivors, but housing has to have its own component, and we have to figure out how to find funding to put just towards housing staff in those organizations. So we'd love to hear more about that, TL, and some of the challenges that you encountered.
As Tony said, it was kind of an on-the-fly learning type of situation. But I think once I got in and I saw what they were currently doing, I just needed to create more structure for the way we were doing things. And it was as you said, we got more hands involved. The way we do it now is everybody has a little piece of the housing program. We bring people in, we do a needs assessment. They'll start off with, our peer specialists, move through the process to see Tony. Then they'll wrap up with me as far as maybe they need community resources, things like that. And usually end up back at Tony again, just to tweak the housing need. I also want to add to that it's a very specific group that we work with, since we work with domestic survivors that are LGBTQ and people of color, and how important that is in the community to have that piece. Yeah. Because as Tony said, we partner with other organizations, but they might understand the domestic violence side of it, but they either didn't understand the LGBTQ side of it, or they didn't understand about people of color. So, I mean, with GLOW, we're able to look at the entire picture and work to the needs of our participants that way. So I think that's a huge thing that GLOW has provided. As far as just, I could go all day about the way we have the housing set up. But yeah, we just have a really good flow and sense of what our participants need. And even with other agencies working on housing, they may put our participants in a section of the city that's not safe for LGBTQ people.
Right.
And that's something that we're aware of. So I just think that we have a better idea of what's going on with the community that we serve.
So with all of that, TL, what it sounds like to me and doing the work with you all over these years, with the flex funding, it has allowed you all as an organization to really hone in on more of the barriers that do come as challenges for participants, and not just know about them, but also to be able to get on top of those, particularly those that are outside of the organization within the community, as you and Tony have shared. That's how in the past you all used to do your work in partnering with other entities in the community. How would you, or what would you share, TL, with those listening of the education you had to do with other partners now that you all had the funds, right, and have learned different ways? How do you all now partner with other entities and providing education to them around the racial equity piece, right, of your population and the LGBTQ portion of that population? How do you present education to those entities?
I think that now organizations that we work with, even just if they're coming in to facilitate like workshops and things like that, we make sure we have that training component for them so they know the type of people that they're going to be working with, that they're culturally sensitive to the needs of our people. We have had organizations that we've had to leave behind because they just couldn't get on board. You know, they were serious in their attempt for the housing, but not as serious for their attempt with the LGBTQ side of it. And we have to have it all. We can't do it with just one piece. So I think Tony probably has more insight on the partnerships with different community groups before I came in.
Okay, Tony, so we're going to pass that baton to you to share with us, and we will begin to wrap up with maybe one or two more questions, but just would love to expand as much as we can for the audience, listening.
So now our process as far as working with community partners, we do a lot of vetting. We have definitely a lot more conversations than just the initial conversation. We really want to know who our folks are, well, who we're first of all dealing with, but also if there's, for instance, like a need from one of our participants, we want to be absolutely certain of if we have to refer you out of GLOW, we want to make for certain that you're going to a place that's going to respect your gender identity, your racial identity, your gender identity, all of those things. We've had instances in the past where and it's not necessarily the agencies themselves, but it's sometimes the people, sometimes it's the first person that you meet in an organization that will completely turn you off from an organization. And I've had to go back, especially in the beginning. Sometimes I would actually go to some of these places with our participants, particularly our Spanish-speaking participants. That was a huge problem in the community. Not only was it the language barrier, but it was also the fact that people didn't really view them as human in a way. So we realized we had to step up our game in a way and truly advocate for our people. Because there were flat out some agencies, and like I said, it wasn't some agencies, some people who had their own biases and things that they needed to confront. And we had to be the ones to say, hey, how you're treating these people is wrong. And we're not here to down you, but we're also here to help train you. We want to make sure that this is a relationship that our participant can be fulfilled in, but also ourselves and you as well, because you are a reflection of the community, the entire community. So we've done a lot of groundwork in that way, not just, yeah, I can go on and on about it for days, but now the process, it's a lot of conversations. And even after we've had that person facilitate or do anything like that, we're still keeping up with that person, still having talks, seeing, checking in to see how are you? Because at any time, this work could not be for you. I mean, we don't want to put our participants in harm's way in that way because we're dealing with so many sensitive issues around what they're going through.
Wow, that is awesome. And Tony and Tia, we are almost at time, but I do have one more question, but it's going to be for the both of you. But before I get there, I just want to reiterate one more time before we close out for all those listening that with flex funding and the way we presented flex funding with the LGBT Center, there is no amount, no specific or specified amount that each client can receive. And there is no specified amount of how many times they can receive funding. The true tenets of flexible funds is just that. However much each participant needs, we are to provide that if it's within the amount of money that we have. And if that takes the money, then that takes all the money. And however many times they come back, we don't keep a score per se. We may track it of what they are coming back for, but there's no penalty or consequence to say, oh no, we gave you X amount of dollars, $1,000 3 different times, and now you're coming for another 500. So you are at your limit. There is no limits in flex funding. And that is where we in the field, the DV field, fall flat sometimes, or where we have trouble getting out of our own way and not create barriers to wanting that to be a barrier or making that an issue for survivors. So I just want to be clear, in flex funding, there is no limits. So if you have questions, you could reach out to NRCDV and we'll be more than glad to work with you in that process. And so TL and Tony, as we wrap up, from both of your points of views, can you just share what do you think, or how do you think we should proceed with flex funding, and how other programs and even the LGBT Center can continue to pursue to receive flex funding through the funders, and or however we make that possible?
I can go first. Honestly, after working with flex funding for so long, I believe that it's the future, especially for community centers like mine. We're able to fulfill so many needs. We were able to work with so many different people. Um, we were able to do so much in such a short span of time with flex funding. I can't understate how valuable that is for our participants and even for staff just to see it, like to see this project through. We had no, well, this is my first job, honestly, since graduating college, and I had absolutely no expectations. And like I said, being able to see the project now for what it is and how much we've gone, because I think throughout the whole process, you're just kind of going. It was so fast paced. Even we never even really got to, I don't want to say enjoy the process, but actually like see it through. You know what I mean? But now that things have slowed down and actually seeing the effect that it's had on participants, this is definitely the future. Um, it's going to help our people um, move forward. And yeah, I'm just grateful to be a part of something like this.
Thank you, Tony. Wow, the future, I like that, Tony. I'll have to write that in my community engagement work. The future, I like that. TL?
I have to agree with Tony. I mean, when you're doing the work, you're not thinking about how much of the work you're doing, but when you actually go back and people are like, you were able to do this, 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 and this with flex funding, you're like, wow, we did really do all of that. And as far as it being the future, I don't think that people who don't have the flex spending don't realize how much of an impact it's actually making. we had multiple people that were able to complete some sort of training or college degree based on the flex funding help. That's the future right there. I mean, it's amazing. You know, that you've helped create a whole, you know, list of opportunities for somebody who didn't previously have that.
Wow, this has TL and Tony, let me first from NRC, thank you both so much for your participation in this policy research briefing and your experience with the work around flex funding, being on the ground and sharing it with our audience. I am so thankful. And of course, I feel even more special knowing that I get to work with you all every day. And so I hold a special place for you all in knowing the work that you all did and the challenges and all of the stuff that came of us all learning together how to disseminate the flex funding and open our minds to a different way. As Tony has clearly stated, the future, and I'm going to always refer to it as that from now on. So thank you both, really, and I hope the audience was able to be open to what was being said today. It's something different. It's another perspective, but it is what we need and what is being asked of all of us in our advocacy. So thank you both, and I will look forward to working with you as we continue to move forward and finding new ways and new perspectives of working with the various populations that we work with and communities, right? So thank you. And with that, I thank you all for listening, and I now will turn it over to my colleague Fumi who is the Director of Research. Thank you all so much and evaluation.
Thank you, Lavon. Good afternoon, everyone. My name is Oyesola Oluwafunmilayo Ayeni, and I go by Fumi. I am the Director of Research and Evaluation with the National Resource Center on Domestic Violence. I use she, her pronouns, and I identify as Nigerian American. Today, I am wearing a black short sleeve shirt. I have on red long earrings, and my hair is slightly wavy. It's black, and it's in a bob length right above my shoulder. And today, my presentation will focus on discussing the learnings from the pilot study conducted by the National Resource Center on Domestic Violence in partnership with the LGBT Center of Central Pennsylvania to implement the flexible financial assistance model for domestic violence survivors, which you've already started hearing about through the panel. Next slide, please. So to provide an overview of our conversation today, I'll just start by briefly introducing the guiding principles of the flexible financial assistance model, and then we'll get into reviewing the program implementation process as well as the data collection process for the pilot. And we'll talk about the findings from the study, including the implementation process, our funding disbursement process, as well as the preliminary evidence that we gathered on the effectiveness of this model. And we'll conclude with a brief discussion of the implications of these findings for future work. Next slide, please. So lesbian, gay, bisexual, transgender, and queer individuals are overrepresented among people experiencing domestic and sexual violence, people experiencing homelessness and housing instability, and people experiencing economic insecurity in the United States. We heard from our panelists, and we also know through research that sexual and gender minority adults are twice as likely as the general population to have experienced homelessness in their lifetime. And similarly, most studies have found a lifetime prevalence of intimate partner violence among lesbian, gay, bisexual, and transgender people that is as high or higher than that of the general population. Next slide, please. And so within lesbian, gay, bisexual, transgender, and queer populations, individuals from minoritized racial and ethnic backgrounds are often disproportionately impacted by domestic and sexual violence and homelessness and housing instability, largely due to the longstanding historical and structural racism. And we heard our panelists touch on this when emphasizing the importance of tailored services for this population. And we also know from research that lesbian, gay, bisexual, transgender, and queer people face a lot of barriers to seeking help that are unique to their sexual orientation and gender identity. And so again, as our panelists had discussed, providing services that are tailored to meet the needs of this population related to safety, housing, and economic insecurity should be prioritized. Next slide, please. And so that brings us to the flexible financial assistance model, which is commonly referred to as the flex funding model, and is not a new or innovative concept generally. In fact, many Black, Brown, and Indigenous communities have been implementing these practices in their communities for many years. And we know that culturally specific organizations working with historically marginalized communities have a very long-standing history of using flexible funds to support survivors. And so while this is not innovative in practice, it is an initiative that is starting to get more attention in mainstream programs and in the broader field. And as it's gaining more popularity, it's really important that we focus on how to institutionalize the model so that we are ensuring that we're not losing the tenets of the flexible financial assistance as a model. And so flex funding, as you may already be familiar with, when we refer to that, we're talking about financial support that's provided to survivors, domestic and sexual violence survivors, to address whatever barriers they have that exist between them and safe housing stability. And so it can be described as an intervention that also focuses on prevention because it helps to provide financial support to survivors to increase their safety, to disrupt the cycle of homelessness that they might be experiencing and housing instability, and also address any obstacles that they're facing to accessing and maintaining safe, affordable, and accessible housing. And so financial support can be provided to address a multitude of needs, which may be directly or indirectly related to housing. Examples of those are things like rental assistance or family activities or move-in costs, or even survivors' physical and mental health needs. And so when we think about the guiding principles of the flex funding model, there are about 4 of them that we center in our practice. First being survivor-driven advocacy. And this is where advocates are really focusing on developing trusting relationships with survivors to listen, to affirm, and to adequately respond to their needs. And the second guiding principle is low barrier access. And so here, we're making sure that funds are accessible to survivors with little to no prerequisites, no service requirements, or even supporting documentation like proof of need or even proof of experience in abuse. Third, flexible funding supports a variety of needs, and there are no limitations on the amount and the frequency of funding. Lavon in the panel that was just concluded emphasized that really, when we're talking about the core tenets, there usually is no predetermined cap on the amount that a survivor can request, the number of times that they can receive support, or the types of needs that are covered. And finally, this focuses on the prompt disbursement of funds because remember, this is providing resources to address their immediate needs, which means it has to be made available to survivors as soon as possible. And according to the guiding principles, we want to make sure that we're making funds available to survivors within 24 to 48 hours, so about 2 days after that request is received. And then finally, this model, while it centers financial support, also focuses on holistic service provision, which means that survivors should be offered wraparound services and not just flexible funding. However, their participation in any of the services that are offered by the organization should be completely voluntary, which means that if survivors decline additional services, they should still be provided with flexible funds. And as much as possible, advocates should provide informational resources, especially resources in safety planning. Next slide, please. And so the purpose of our expanded pilot was really to document what it takes for organizations to implement the model from the lens of advocate, as well as providing preliminary evidence of the impact of this model on the lives of Black, Brown, Indigenous, people of color survivors, and lesbian, gay, bisexual, transgender, and queer survivors, and really centering the perspectives, the firsthand perspectives of survivors, as well as advocates in this process. Next slide, please. So as the panel mentioned, this project started in 2022 and it was concluded at the end of 2023. However, while the project itself spanned over 2 years, and that accounts for all of the activities under this project, the funds were actually only dispersed to survivors over a period of 5 months, between August to December of 2022 and August to November of 2023. And I want to call specific attention to the disbursement period of 5 months, because in just that amount of time, almost 60,000 was disbursed to survivors, which demonstrates very well what the panel was expressing around the extent of needs that survivors had. And we'll discuss how these funds were specifically dispersed in more detail shortly. But in terms of the data collection process, the research team worked really closely with advocates from the LGBT Center throughout the duration of this project. We had initial conversations to discuss the model and provide guidance on how to implement the model in alignment with its core principles. And once the project started, the team continued to meet with staff from the center to provide support on any issues that came up. And then to gather information, advocates completed a tracker, and that tracker was a spreadsheet that collected information on participants' demographics, details related to the funding requests and how the funds were dispersed, as well as the immediate impact of the financial support provided. We also conducted in-depth interviews with the advocates directly involved in dispersing the funds to participants so that we could gather more information on the organization's implementation process. And then we held a focus group with 10 survivors who received funding so that we could gather more information on the impact of the funds for them directly from their lens. Next slide, please. And so to share briefly about how the organization implemented the flex funding process, participants were informed of the financial support that was available, mainly through word of mouth. Advocates shared about the assistance in interactions with participants. The organization also has a youth advisory board that served to share information with GLOW participants. And advocates also noted that there were instances where participants informed other participants about the financial support available. Next slide, please. And so in terms of the implementation process, it went something like this. Advocates would identify the need for financial support through conversations with participants. Then supplemental materials would be requested if those funds needed to be paid out to a third party, and or the funds would just be made directly available to participants if it did not involve a third party. Next slide, please. And so this slide outlines the social demographic information of survivors who received funding through this pilot. And so a total of 63 survivors were served. These survivors were between the ages of 18 and 38 years old, the median or average age being 27. We had about 62, so most of the participants, about 98% of them were Black or Latinx. And we had about 29% of the survivors who identified as transgender. 16% indicated that they had children or individuals who they were children who were theirs or that they were responsible for raising. And about 9% identified that they were immigrants and or refugees. Next slide, please. And so this slide presents a table that outlines the various disbursement methods, which consisted primarily of direct payments that were made to third parties. About 74% of the funds were dispersed by way of paying it out directly to third parties, and these cover things like rent, these cover things like purchases that survivors wanted to make. And then we had about 15% of the funding being dispersed through merchant gift cards. So gift cards for particular services that survivors needed. And we had about 11% being the smallest percentage of funds made as direct payments to survivors. And those included things like gift cards and check, and in one instance, cash. Next slide, please. And so this particular slide represents the amount of times that the number of times that funds were paid out to participants in relation to the length of time that it took. So one of the things that I had shared earlier is with the guiding principle of flexible funding, we want to make sure that funds are made available to survivors within 24 to 48 hours. As soon as possible. And so what you notice here is a bulk of the funds were dispersed through same-day payments. About 83% were made through same-day payments. And then we had about 7% that were made between 1 to 3 days, and about 10% that were made between 4 or more days. And when we probed further to understand why there were some payments that were made 4 days and above, a lot of those had to do with third parties. And so it accounted for the time that it would take advocates to work with survivors to get all the information that was necessary to then get the payment out. But like I mentioned, most of the payments were made within the same day, and that accounted for the greater percentage. Next slide, please. And so how much was distributed? I had mentioned earlier that almost 60,000, so a total of $59,752.41 was dispersed and distributed for survivors. And what that looked like was each unique disbursement ranged from about $7 to $2,800, which means at each time that funding went out, survivors received as little as $7 and as much as $2,800. And that was completely dependent on the amount that they requested. And then finally, when looking at the total amount that was provided to or on behalf of each participant, participants received between $7.92 to about $4,894, with more than half of the participants, so 57%, got over $500. And so you start to see really the diversity in the needs that survivors have, where survivors just need sometimes as little as $7 and sometimes they need as much as $2,800. Next slide, please. And all of those payments really accounted for 199. So that's a total number of times that funds were dispersed to on behalf of participants. And it's important to highlight this number because it really speaks directly to the amount of handling and administrative paperwork that advocates and organizations have to deal with when implementing flexible funding, and is such an important component of the work that often gets left out. And so we see that there were a lot of payments being processed, the sheer volume of payments that mostly two advocates were responsible for holding. And what that broke down to, it looked like about 1 to 15 payments per participant. So we had participants who only needed funding one time, and then we had participants who needed funding up to 15 times. And that, again, ties directly to what our panelists were sharing earlier about the diversity in the needs that that survivors often have, which means that there isn't really any one-size-fits-all approach to providing support, and each support that's provided to survivors has to be tailored to meet their individualized financial needs. Next slide, please. And so here we're starting to get into what did all that money go towards? Part of our tracking was really trying to understand how funds were dispersed. And what you see in this slide, or what is represented in this slide, is a table that denotes the category of needs, as well as the number of times that funding was provided for that specific need. And so we see here that the highest number of times in terms of the category of disbursement was transportation, which means funds were dispersed 67 unique times to cover transportation needs that survivors had, and then followed by basic needs. Funds were dispersed 43 times to cover basic needs that survivors had. And we also see that rental and mortgage assistance, as well as emergency hotel stay, those accounted for 19 times. Now, it's really important to point this out because although rental and mortgage assistance and emergency hotel stay only was dispersed 19 times, what you'll see in the next slide that will come up shortly is that they actually accounted for more of the funding. And so again, it takes us back to this notion that a survivor returning for funding multiple times does not necessarily mean that the amount of funding that they're going to receive over the time of disbursement is going to be significantly higher than someone who only came to receive fund one time. Because in that one time, that person might receive a much higher amount compared to a survivor who only needs a lesser amount of money multiple times. So again, it's really challenging and inviting us to interrogate some of our preconceived notions and assumptions about who's requesting flexible funding, what these funds are being used for, and how we understand the importance of this monies. Next slide, please. And so as I was saying earlier from our last slide, what this slide represents is another table that shows the category of needs that survivors were able to receive funding across, and then the total amount that was dispersed. And so while rental and mortgage assistance only accounted for 19 unique disbursements, what we see here is it actually accounted for the bulk of our funds, where about 44% of these funds were dispersed to survivors to cover their needs around rental and mortgage assistance. It's also really important to emphasize the mortgage assistance portion of this, because part of really centering equity for survivors and responding to their needs is making sure that the funding that we provide is responsive to their situations. And while there are survivors who are in rental housing, there are also survivors who are homeowners and require support for their mortgage. And so it's very important that the funding that's available for housing assistance is not limited to rental assistance, but can also support survivors who are homeowners or aspiring to be homeowners. And then we see it that about 12% of the funds, amounting to a little under $7,500, was dispersed for basic needs. That was closely followed by emergency hotel stay, and then transportation, move-in costs and deposit, and then general debt assistance, which accounted for about 5% of the funds. Next slide, please. And then connecting this work again to one of the core principles, guiding principles of flexible funding, which is that survivors should not just be offered flexible funding, but where possible should also have access to wraparound services, as long as those services are not made a requirement or a prerequisite for receiving flexible funding. And the LGBT Center did just that. We had about 75% of the participants who received flexible funding also received services through the LGBT Center that ranged from things like participating in the food and hygiene pantry, dinner service, HIV and STI testing, case management support, as well as support with completing housing applications. Next slide, please. And so all of that brings us to the evidence that we were able to gather on the effectiveness. And like I mentioned, we conducted in-depth interviews at 2 time points with advocates who were directly responsible for dispersing the funds. We conducted a focus group discussion with 10 of the participating survivors. And we also gathered information through that tracker that documented what the need was for and the immediate impact of the need. And through all of that data, what we found was that dispersing flexible financial assistance to survivors helped to yield a 50% increase in their housing stability. And so specifically about 21 survivors, that's 33%, were able to remain stably housed, which means they didn't need to just move from one home to another. They could remain in the home that they had chosen. And we had about 17% who actually were able to move from being homeless to being temporarily or permanently housed. So we really start to see the concrete ways in which flexible funding can directly help impact housing stability and prevent and interrupt homelessness for survivors. Next slide, please. And so for the impact on housing, this is a quote that we gathered from one of the survivors in our focus group discussion. And this survivor said, "One time I used the money for my rent after falling behind for a few months, so I don't have an eviction on my record. I know people who have been evicted and it only makes it harder to find a new place. I'm glad that didn't happen to me." And so this survivor is speaking to these funds being really instrumental in helping to prevent homelessness and also prevent an eviction record, which we know is a documented cause of housing instability for survivors and other individuals. Next slide, please. And then this is a quote from an advocate that speaks again to the impact on housing that these funds had. And this advocate said, "I've worked with one family. They were a trans man, cis woman, and they had 6 kids. They were in a pretty bad position here in Harrisburg. They came to the center, they filled out an emergency housing application. They talked to us about where they wanted to go. They were saying that they didn't think Harrisburg was just right for them. We found a place through a friend in West Virginia, and we were able to cover the cost of a moving truck, rent, and security deposit to get them down there." And again, speaks to the versatility and the multitude of needs that survivors have. Next slide, please. And then we also focused on documenting the impact that flexible financial assistance had on the safety of survivors. And these are quotes. I'll read the quote from the survivor first, and then I'll read the quote from the advocate. The quote from the survivor goes thus: "I would have gone back to my abuser if I didn't get this flexible funding. Not because I want to. I don't like being with him, but what choice do I have? I need to pay my bills. I need to eat." And this speaks directly to the difficult situations that many survivors often find themselves in when they do not have the economic resources to advance or maintain safety, and as such have to remain in unsafe environments and conditions. And then the next quote goes thus: "We'll never be able to count how many people may not be engaging in sex work because they know they can come here and get help." Next slide, please. Similarly, we looked to document through the qualitative work some of the impacts that receiving financial assistance had on the financial and economic security of survivors. And this is one of the quotes from survivors: "Because of the money from GLOW, I am closer to my savings goals. When I needed money for an emergency, I didn't have to take it out of the money I was saving for something else because GLOW covered it." And again, this really speaks to survivors being multidimensional individuals who have multiple needs. And part of the reason why flexible financial assistance really is helpful is because when survivors are in an emergency or dealing with an immediate need, these types of resources are able to provide relief such that they do not have to further disrupt their lives or routine to regain a sense of normalcy. Next slide, please. And then this quote speaks to well-being and the ways in which receiving flexible financial assistance improved survivors' well-being. And it goes, "I'm able to meet my needs without depriving myself. I don't have to choose between buying groceries or paying my water and electricity bill. I can do both." Next slide, please. And similarly, this is a quote on well-being from an advocate's perspective. "We are seeing less shame, more ownership, and excitement about what they're working on. I think that's just like human pride. They think, okay, you might be covering my rent this month, but guess what? This time next month, I'll have the check from this job and that job. I'll be able to cover my rent. Just knowing that one thing is going to be taken care of allows people to free up space in their mind to dream, to plan, and work towards a goal. When we talk about survivor empowerment and we talk about survivor well-being, this is in fact what we all aspire to, being able to support survivors so that they're in a place where they are able and well equipped to dream, to plan, and work towards their goals. Next slide, please. In addition to the individualized impact that flexible financial assistance has on survivors and their families, we also wanted to document the organizational impact. And this is a quote from an advocate that speaks to the organizational impact. These are individual autonomous people with their own thoughts, goals, plans, and we're able to support them on those missions. And the flexible funding has been an instrumental tool in making that possible. And so this really speaks to the ways in which having access to flexible funds to support survivors does help enhance an organization's programming and ability to continue to live into the mission and vision of supporting survivors in meaningful ways, particularly for organizations that work with survivors who experience multiple forms of oppression and discrimination. Next slide, please. And then we wanted to document the unique impact of this being a flexible financial assistance pilot project that is offered by an LGBT specific service provider. And we spoke with survivors to try to understand better what their experiences were with the center in comparison to other mainstream organizations that they have attempted to receive services from, or they were able to receive services from. And so this quote speaks to one of the survivors who recounted a negative service experience that they had with an organization that was not tailored specifically to serve the needs of lesbian, gay, bisexual, transgender, and queer survivors. And they said, the person I was talking to kept misgendering me, even after I said something. It felt hostile and intentional, and they didn't have any opportunities for me. And this narrative really tells the story and paints the picture of many survivors who identify as lesbian, gay, bisexual, transgender, and queer when they're attempting to seek services, and connects really well to what is documented in research about the barriers associated with seeking services that are unique to gender and sexual minoritized populations. Next slide, please. In addition to documenting those negative experiences, we wanted to hear from survivors how interacting with the center specifically, as it is an organization that provides tailored services for the population, was impactful. And so this is a quote from a survivor who was recounting a positive service experience with the center. And they said, working with the center was better than my other experiences. It gives me hope that there are people that will help you without judging you. Next slide, please. And so we've talked about a lot of things. We have centered the importance of recognizing the discrepancy that exists in the landscape for survivors who identify as lesbian, gay, bisexual, transgender, and queer. We've highlighted the guiding principles of flexible funding and discussed the ways in which it was actualized through this research project, pilot project. We've talked about the different sources of data that we've collected and our findings across the spectrum of this project, really highlighting what types of resources survivors have and how much of our funding went towards those different categories of resources that survivors needed. To correct that. And we finally concluded with really hearing firsthand through the quotes that we've presented how this funding was impactful for survivors from their own lens and how it was impactful for the organization. And so what does that mean? It really tells the story that flexible funding can increase safety, it can increase housing stability, and it can increase well-being for Black, Brown, Indigenous people of color, survivors, as well as survivors who identify as lesbian, gay, bisexual, transgender, and queer. It also means that we need more research, as we've seen today, to really delve into, with a larger and more representative group of survivors, the unique needs of this population and continuing to expand on the longer term impacts of receiving flexible financial assistance. Next slide, please. It also means, in terms of our implications, that implementing a flexible financial assistance program requires significant investment. It requires a significant investment from federal, state, and local funding agencies, including philanthropy. And it also necessitates that organizations take the time that is needed to assess their readiness and their capacity to implement flexible funding programs with fidelity, considering the amount of work that can go into setting up and executing a flexible financial assistance and program, as well as the specific guiding principles that should be put in place to be able to implement this program with fidelity. And so with that, I am glad to turn over the stage to Shenna Morris, who will share more about the policy implications of this work. Thank you.
Thank you, Fumi, and thank you, Lavon and TL and Tony. This is Shenna speaking. And so in continuing to build on the Flex Funding pilot project and the report, I'll be sharing some of the policy recommendations that were identified. But before immediately sharing these policy recommendations that surfaced from the report, I'd like to take a moment to ground us in NRCDV's policy stance as a point of reference that provides additional texture to our recommendations. So we'll start with our commitment to being expansive in our policy thinking, efforts, and focus on anti-violence work within the larger context of social justice and progressive world building. Next slide, please. Our commitment to co-creating policy solutions with survivors and communities most impacted by gender-based violence and sexual violence, and to address the root causes. Next slide, please. And our commitment to advance policy solutions that will make meaningful change for Black and Brown communities, trans and non-binary survivors, survivors with disabilities, immigrant survivors, and those most traumatized and harmed by carceral systems and responses. And so I'm hopeful that you will see these commitments reflected throughout the policy recommendations that did surface from the report. Next slide, please. So we first start with the recommendation to increase support for culturally specific programs that have deep expertise in responding to the needs of marginalized and underserved survivors. Increasing support for culturally specific programs enhances housing options that are culturally responsive, diverse, and innovative. And we've seen that today through the panel sharing as well as reflections from the report. Second, increase administrative support for DV and SA programs and service providers. Increasing the use of funds to support administrative needs of programs strengthens their capacity to adequately hire, train, and retain staff, as well as ensure that funds are used efficiently, appropriately administered to survivors, and effectively capture impact. Third, allow federal resources to be used flexibly. enacting policies that allow federal resources, such as those provided through the Family Violence Prevention and Services Act funding, and housing and urban development special needs assistance program to be administered and used in the true spirit and value base of flexibility, as we've heard both Fumi and Lavon speak of multiple times during the briefing. Research has shown us that access to flexible funding resources aids in the prevention of survivor homelessness, as you just heard Fumi speak about. Administrative and legislative policies that would allow service funding to be used flexibly supports survivor-led advocacy, as well as the maximum and best use of public resources. Next slide, please. Our next recommendation is to widely distribute best practice and model program information. Informing funding recipients and communities of existing and emerging housing programs and service models supports awareness raising of the diversity in available approaches and solutions for survivors. Additionally, doing so encourages continuously strengthening equity practices in the replication and tailoring of programming. And our final recommendation is to increase support for methodologically, what a word, diverse research and evaluation. Increase support for research and evaluation studies using diverse research methodologies to assess the implementation process and impact of the flexible financial assistance intervention on survivors and their children. So again, I hope that you have been able to see a reflection of our commitments through these policy recommendations and how all of the things that we have shared together have shared today come together. So with that, I will hand it over to our Director of Safe Housing, Brittany Eldringham, for any additional questions that have surfaced during the briefing. Thank you.
Okay, so I have been tracking folks' questions. Oh, my apologies. My name is Brittany. I'm speaking now. I have my hair in a ponytail. I am wearing some brownish toned lipstick, and I have a collar, a shirt with a black collar on. So I have been tracking the questions in the chat. Some folks have received answers to their questions, but I want to read those aloud to make sure that they are captured for the recording. There was a question, and I see that TL has just provided an answer in the chat. Were there any types of requests for funds that were denied? Are there specific categories that funds had to fit into? And TL responded to Carrie in the chat and said, as the funds are to be given without question, we did not deny requests when funds were available. However, most of our funds were requested for housing needs. And I think Funmi has something that she'd like to add to that as well.
This is Fumi. Thanks, Brittany. I wanted to add to that the report that we put together, the initial process evaluation, includes a table that lists out the different categories of funds or of needs that survivors could request funding for. However, there is a final category that says other needs to capture anything else. And really the reason for developing a category of needs was so that we could, for our evaluation process, better understand the diversity of needs among survivors. It was not developed to limit what survivors could receive funding for. Thank you.
When we maybe stick around, because I think you might be able to speak to this question a little bit. I do want to read the answer that TL was kind enough to put in response to. Someone asked, did you get to build the data platform, or are you provided a mandatory data structure? So TL said, we were provided a tracking spreadsheet to be reported back to NRCDV. However, with that and a combination of our in-house tracking, we were able to determine if people had additional needs beyond just financial help. I did want to see, Funmi, if there was anything that you wanted to add about sort of the tracking process.
Thanks, Brittany. This is Fumi again, and many thanks to TL for responding to these questions in the chat. And I have nothing to say that's different, but just to add on that, yes, we really focused in our process of developing this tracker, we really focused on how do we collect this information in the least burdensome way, particularly keeping in mind that advocates were going to have their hands full, as we've demonstrated with the data, with the day-to-day of running the program and dispersing these funds. So we developed a tracker, and we also wanted to make sure that it was something that was easily accessible. So it's just an Excel spreadsheet that includes different rows and columns with the different questions that we were hoping that the advocates would be able to track. We shared that. We made sure it was secure in a password protected folder that only the evaluation team and the advocates at the center could access. And we just made sure to touch bases on a monthly basis and then check in with them if they had any questions about completing it. And again, all of the questions that went into this tracker are in our report at the very end of the report in the appendix. And so if you are looking to create something similar within your organizations, please feel free to use that as a starting point.
Thank you, Funmi. So Dana put a question into the chat that asks, and I think a few different people can answer this if you'd like. We have some flexible funding from a funder that requires we disperse the funds equitably. How can we better understand what this means so that we can ensure we are being equitable while not placing barriers or limitations on our funding? And I will add that Doris, who is another community partner of NRCDV, offered something really lovely in response and said, if I may humbly suggest, perhaps partner with organizations that reach populations that you don't typically reach, which I think is great. So I want to open that up and see if any of the other speakers have a response to that question.
Brittany, hi, this is Lavon speaking. I first was going to ask, when they speak about dispersing funds equitably, I don't fully know what that means. So I'm just going to suggest, opposed to trying to be equitable, to just do what Fumi and I worked with the LGBT Center on the core tenets of flexible funding, and don't assign an amount. In this way, the equitability will come from what each individual participant needs at that given moment, based on the amount of funds that are available, and not about trying to make it a fair share for each person. Because as the study showed that Fumi just did, though transportation was the highest number of what people requested, you saw that housing had the highest dollar amount of the need. So it's not a matter of it being equitable and everyone receiving it across the board. It's a matter of being equitable based on how each individual needs the funds. And I hope that makes sense. And I see my colleague Sheena's hand was up or still is up. And then Fumi. So I'm going to just sit that part of what my brain knows of the tenets and the principles of flex funding.
This is Shenna speaking. Lavon, you touched on exactly what I was going to say and share, is that us keeping in mind and holding that equitable does not mean equality. Equitable is really striving towards what the individual needs, and that is aspiring to be equitable, is truly meeting the needs of the person as they have defined them or disclosed them to be.
Thank you, Lavon, and thank you, Sheena. This is Fumi. I wanted to add that it's really important when thinking about equity to start from a place of who is in your community, doing a scan, sort of like a landscape scan of who are the people that you are serving? What is the neighborhood makeup? What is the city makeup of where you're located? Who has access to you? And really getting a disaggregated record of that along the lines of the different identities that survivors will often hold, paying particular attention to the intersectionality of those identities from minoritized perspectives. So gender, race and ethnic minoritized individuals, gender and sexual minorities, people for whom English is not a first language or prefer or feel comfortable speaking in another language, survivors with disabilities, deaf and hard of hearing survivors, really getting a comprehensive overview of who's in your community, and then being able to track who's receiving your services to make sure that they are representative of the community that you serve. And that also means collecting disaggregated data. If you are noticing that while your community is largely BIPOC, you're serving predominantly cisgender white people, that is a flag, and that is something that needs to be brought back to the group and further discussed. So when we're talking about equity, a way to also start is who's in your community, make sure that it's reflective of who your program is serving. And if it is not, then really thinking about ways to reach the folks who are in your community, addressing any barriers that exist that makes it less likely that they will come to your organization for service, or that when they're in your organization, that they would receive the services that they need. Thank you.
And just to round off that point from Funmi, although you have a response from Dana, who says, thank you, Lavon and Shenna. That explanation was very helpful. And thank you, Funmi. I appreciate the additional considerations. Dana, I would add that what Funmi just said is very often encouraged in the continuum of care and homelessness and housing spaces. It very much mirrors and echoes what communities are encouraged to do in terms of making data-driven decisions for their HUD homelessness and housing dollars to support equity in their communities. And so I think you'll see that that you can find that information elsewhere that encourages folks to really look at what is the information that's available. And if you don't know where to get it, as Funmi mentioned it, starting with your local continuum of care is a great place. We're doing great on time. I don't see any other questions in the chat that have not been answered or addressed in some way. So I do want to just wait a couple more minutes. This is also an opportunity if you'd like to raise your hand and unmute yourself, if it's easier to ask the question as opposed to typing it out. We want to encourage multiple ways of participation. So we'll just give it a minute and see. Okay. Well, we can go through our next few slides, which are just going to wrap up this conversation today, and we'll see if anything lands in the chat or if anyone raises their hands in the next couple of minutes. Brecken, could you please, look at that. Okay, thanks for advancing. All right, so just a flag for safehousingpartnerships.org. This is a vehicle for a lot of the resources that are created within the Safe Housing Partnerships Technical Assistance Consortium. This is a forewarning that that website is currently being redeveloped and redesigned, and it's actually just about to launch very, very soon. That is where you will be able to find the report for the expanded pilot project that we have been referencing for the last couple of hours. And that is also where you can request additional technical assistance from either the consortium or any of our partner organizations specifically. Again, that website is in construction right now, and you will see something brand new in just a little bit. Brecken, can we advance? Thank you. So this is just sort of echoing what I just mentioned. You can email us directly at housing@nrcdv.org. You can also follow us on Facebook or find us on Instagram through NRCDV by searching NRCDV. Next slide, please. This is just a thank you to our grant funders at the Office for Family Violence Prevention and Services. Next slide, please. And lastly, we just want to encourage you to complete our survey. We are always trying to improve our offerings. I will also put a link in the chat for those who are not quite familiar with the QR code or quite as savvy with it. I have not seen any additional questions, but really want to thank Tony, TL, all of our speakers, Lavon, Funmi, and Shenna, as well as our incredible interpretation team. That includes our ASL interpreters, Anne and Heidi, as well as our Spanish language interpreters, Irwing and Lars, and we really want to thank our remote captioners as well. I think that's everyone. If I can multitask successfully, I will be able to get you that evaluation link. Here we go. How quickly can I do it? And in just a second, we will be able to stop the recording, and we want to wish everyone a wonderful rest of the day and a great week. Thank you all so much for being here. Oh, okay. Maybe that was an accident. Yeah. Thank you all so much.